2023 marks the third year that the world has faced the effects of COVID-19. This global pandemic brought sweeping changes to everyday life, social distancing and masking, how our schools handled sick kids, how we visit our healthcare providers, and now more recently, how parents obtain over-the-counter medications for their children. PBS 39 is proud to bring you this community conversation, Health and the New Normal, live from the Univest Public Media Center in Bethlehem, Pennsylvania, and streaming on LehighValleyNews.com.
Capital Blue Cross is a proud supporter of healthcare programming on PBS 39. Medicare coverage backed by over 80 years of healthcare expertise, serving 21 counties in central Pennsylvania and the Lehigh Valley. Capital Blue Cross, going the extra mile.
Here's your host, Brittany Sweeney.
Good evening, and thank you for joining us. Tonight, we take a closer look at post-pandemic changes in our everyday life. We'll explore if those changes are here to stay. Will drug shortages continue to hinder our ability to bring comfort to our children? Will the role of nurses in our schools continue to expand and exhaust these dedicated professionals? On May 11th, the COVID-19 Public Health Emergency Declaration will expire.
While the virus is not gone, thanks to the resilience of the American people and the ingenuity of medicine, we've broken the COVID grip on us. COVID deaths are down by 90%. We've saved millions of lives and opened up our country. We opened our country back up, and soon we'll end the public health emergency.
Now, COVID services many receive for low or no cost may get more expensive. Things like vaccines and booster shots that have been our primary method of fighting COVID. As we look back over the last 2 years, the U.S. participated in the largest adult vaccination program in the country's history, with nearly 270 million people receiving at least one COVID vaccine. Here's a look at some of the numbers now. Since this time last year, reports of daily COVID-19 cases are down 92%. Coronavirus deaths have declined by over 80%, and new virus hospitalizations are down nearly 80%. Now, that's a drastic difference from the start of the pandemic. And with that, let's bring in our first set of guests. Dr. Timothy Friel is an infectious disease specialist and chairs the Department of Medicine at Lehigh Valley Health Network. Dr. Jahre also specializes in infectious diseases. He is Senior Vice President of Medical and Academic Affairs at St. Luke's University Health Network. Welcome, gentlemen. Thank you so much for joining us this evening.
Thanks for having us.
It's great to have you. And Dr. Jahre, we're going to start with you. Those numbers sound good on paper, but is that what we're seeing here in the Lehigh Valley at this point?
To some degree, they're accurate. But I think it's fair to say, although we would like to say that we're done with COVID, COVID is certainly not done with us. And what we've been seeing in terms of hospitalizations has been within a relatively same range within the last several months. What is really different, though, are the numbers of cases that are occurring outside of the hospital. And one has to remember, since there's a lot of self-testing or no testing that's being done, there is not a good reporting system. So for every case that we think we know as outpatients, the estimate is there's 10 or 12 more of those. So I think you'd be hard-pressed to find a family right now that doesn't know someone or has someone in that family who hasn't had some experience with COVID within the last several months.
Sure, both vaccinated and non-vaccinated at this point. And Dr. Friel, do you think that those numbers support the president's decision to end this declaration?
So I think nothing magical happens on May 11th when the declaration ends. I think we agree with that. And Jeff is spot on. COVID is not going to be gone, nor should it be forgotten. And the impact is tremendous. 3 colleagues today I talked to during the course of the day home with COVID. So this is still impacting us. It's impacting us in our home lives, in our work lives. It really impacts all aspects of what we do. So we're moving to a different time. This is a disease that's becoming more endemic. I don't think it's going to go away. And I think we have to be prepared for potentially more challenges and curveballs in the future.
Sure. So you said nothing magical is going to happen in May, but what does that mean for people that this declaration is going away then? What did they receive? And what will they not be receiving at this point?
Yeah, so certain things will change. There were things that were put in place at the beginning of the pandemic by the government that went into effect because of the public health emergency. The public health emergency changed some rules and regulations that allowed us to fast track the development of the vaccines that have saved millions and millions of lives. Also allowed us to gain access to new medications to treat COVID-19 infections, to tests that help us identify people with disease. So it really has been miraculous. The waivers that were put in place, or some of the changes that were put in place, also allowed people to maintain their insurance. So, for example, Medicaid subscriptions increased by about 30% during the pandemic. With the end of the declaration, some of these waivers go away. So the ability to get free medications might go away. Free tests from the government won't occur anymore. A lot of this is going to be determined by what type of insurance you have. And we recognize many Americans will lose medical assistance. So that is a challenge for us, and it's one that we need to prepare for.
Sure,
Let me be very specific about that, though, because I don't think that I want people to panic. What really happened with Medicaid is that in the past you had to recertify to get your Medicaid every year. And what happened during the COVID emergency was that recertification process was put on hold. So right now it's back again. People who would qualify previously will hopefully qualify again for Medicaid. The issue will be for people who have an increase in their income and they may not qualify. The same is true, by the way, for the availability of tests and the availability of treatments. All of that was free, and certainly it will not necessarily be free for people who have insurance. There may be copays. The other major example is telehealth. Telehealth, to a large degree, was covered during the pandemic because people couldn't get out, and we didn't want to encourage people to get out. Right now, many of the telehealth issues will not be covered, or there will be a copay. So there are things that I think are going to radically change for some people, but for many people who have insurance, it won't be a major difference. There will be increased costs for some of these things, but in a lot of cases, the insurance companies will cover it. It's for the people who sort of fall between the cracks. Those people are going to have an issue.
Sure, and let's take a look at some of those numbers and discuss further Medicaid. States received billions of dollars in aid from the federal government on the condition that no one be removed from Medicaid until the public emergency had ended. Now that it will, the fallout could be disastrous for those people who will lose that Medicaid and in turn losing health care coverage. So here's a look at some of those numbers. It's been estimated that somewhere between 5.3 million and 14.2 million Americans could be affected and even suffer a lapse in coverage as state agencies struggle to get them re-enrolled. Now for Pennsylvania, that could mean about 500,000 people. So Dr. Jahre, as you just said, you kind of said who is going to kind of fall through the cracks here, but what does that mean for them? What could they be losing?
Well, in some cases, they will lose their insurance, and that is going to be a major problem. So we're going to have a catchment method for those individuals, and I know many of the hospital networks, including my own, are planning for that. It's also important to know that this is not going to be a sudden situation. There is a large stockpile of vaccines that are available. That's not going to disappear. So if those availability is there, they will be given out free. The same is true with the testing supplies. And it is also true with some of the same drugs, for instance, the Paxlovid or the Merck drug.
Sure, and Dr. Friel, does this mean on the very base level, you know, most of us were able to go out and get a vaccine for free? Will that change, or should insurance companies cover this?
I truly believe that many insurances will cover the vaccine and the administration. And I think there's going to be increasing public pressure as well as political pressure on vaccine manufacturers to make the vaccines available. You've seen this play out in the press over the last week. Moderna just recently announced that they are committed to making their vaccines free and available. Let's hope that does play out and that access is not compromised for folks.
But on the other hand, Pfizer has also said that their vaccine will cost between $110 and $130.
Wow.
So for people who don't have insurance or have no other way of picking that up, it will be problematic.
Sure, and for those folks who do go out and get a vaccine, is this going to be like the flu shot? Dr. Friel, is this going to be like we have to get this every single year? It's kind of been a gray area up until this point. You know, at first it was get those 2 doses or get that 1 dose, get the booster. Is it like the flu shot now?
I think it's a bit to be determined. I think there is pressure to make this more and more like the flu shot. As far as seasonality, say we're going to do it once a year. We're still learning, and there's been a lot of humility. I think that we've had to embrace throughout the course of the pandemic. We are still learning from a virus that continues to change. So recent discussions by thought leaders in this area are suggesting that we're going to move towards a fall administration of a once yearly or an annual vaccine. But I think we're going to have to see how the virus plays, how it changes, and is this a strategy that's going to work? And will we need different strategies for different populations, for those who are perhaps older or immunocompromised who might be at greater risk?
Sure.
Yeah, in summation, I'm not willing at this point to embrace the idea that we're going to need a once-a-year vaccine. The changes in the constituency of the variants and the virus itself make that possibly improbable to do. So I think anyone who actually is saying that we're going to need this right now is really talking without good evidence.
Sure. Dr. Jahre, are you hearing anything from your patients that they're worried about some of these free or low-cost COVID measures that are set in place, them going away? Are your patients worried about that?
I don't think that the reality has hit given individuals. And, if you ask the average patient, do you know what your insurance actually covers right now that has nothing to do with COVID, you'd have a hard time finding out. And that is a changing landscape. So I think once it actually hits, then people will realize. And what we have to do as a healthcare network is prepare for that and to make sure that our community is safe.
Sure. Dr. Friel, would you like
I
to
agree.
add to that?
I think we have been here at the side of our community really trying to help them navigate this from the very beginning back in 2020, and that's not going to continue when a public health emergency is declared over. So that work will continue. We will continue to advocate. We will continue to care. We will continue to do all the things that we need to help our community stay as healthy as possible.
Sure. And then, Dr. Jahre, I want to quickly just touch upon the triple-demic we saw this year. We were dealing with COVID. We were hiding out from all of these other viruses. And then this year, all of a sudden, it's flu, it's RSV, it's the common cold even at this point.
Yeah, one of the unfortunate aspects is that because of some doubts about the vaccine and the way that it was communicated, and I want to say that was faulty. And if you want to, you can read an op-ed editorial in the New York Times and certainly the Wall Street Journal. They're the two opposite ends of the spectrum, but they agree. The communication of what this vaccine can do and what it doesn't do has been faulty. And because of that, people have not availed themselves of the vaccines that we know that work, for instance, influenza vaccine. And that's what worries me for the future, because unfortunately, we made it sound like these vaccines were going to put COVID behind us. That obviously is not the case. What they did do for a large part of the population is protect the most vulnerable from the worst outcomes. But it doesn't necessarily protect you from becoming infected. And had they said that initially, I think we would be a lot better off.
Sure. Dr. Friel, we thought we were over the hump when it came to COVID, and then all of a sudden all these other viruses say, we want to play. Did you see the same thing at LVHN?
Oh, very much so. And again, some of the common players, influenza, RSV, as well as the other viruses, they said this is their year to reassert themselves. We again weathered that storm. What we saw, higher peaks, earlier seasons for both RSV and flu, but thankfully both of those have come and gone. Looking forward to the future, how things will play out next year, we just don't know. I do agree with Jeff. I think one of the biggest repercussions of the pandemic is an erosion of public faith in what vaccines do. And we've seen this play out across the board, whether you look at Medicare beneficiaries and the percentage of those individuals who are getting vaccines, the number of pregnant women who complete their vaccine series during their pregnancy, those numbers have dropped consistently from 2021 to 2022.
And childhood vaccination.
Very much so.
We're seeing measles reassert itself right now, and obviously polio is another potential problem.
It's scary.
So
it's scary.
It's scary, and it puts all of us in jeopardy. And the fact that public confidence has been eroded by sometimes, as Jeff said, mixed messaging, sometimes purposeful misinformation about vaccines and what they can do has really led, I think, many members of the public astray. So we've got to get people back on track. We've got to build confidence again because vaccines truly have been lifesavers, not only for COVID, but for all the other illnesses that we've talked about.
And I think that should be the bottom line message, that vaccines are one of the biggest advantages and advances in this century. And so to actually tar all of the vaccines is a very bad mistake, and it will have major repercussions for us in the future.
Sure. We have so much to cover. We are going to talk to you gentlemen in just a little bit. Thank you so much, Dr. Jahre from St. Luke's and Dr. Timothy Friel from LVHN. We'll bring you back in the show in just a bit.
Thank you.
All right. Earlier this week, I stopped by Main Street in Bethlehem to hear how the lives of those in the Lehigh Valley have changed. What's their new normal? Here's what they had to say.
I'm an RN, and it's unbelievable. It's just in every possible capacity it's changed. The healthcare system right now is just grappling at the onset of COVID and just spinning its wheels in every way, trying to catch up to the pre-pandemic life. It's a lot. It's been a tremendous monkey wrench thrown into just regular healthcare.
It's pretty much completely different. We have a pandemic baby, and I mean, childcare has changed. My work has changed. I mean, trying to go into buildings, I don't have a mask anymore because we think we're vaccinated, but you need a mask still.
Everyone has been impacted by this pandemic in one way or the other, right down to the supplies we need. Supply chain problems have been felt across the country, including here in the Valley.
Like paper towels, yeah. Toilet paper, yeah. Cleaning products, yeah.
Just from a work-related aspect, there have been delays in things like wheelchairs, things like formulas for infants, things like, hygiene issues like adult garments that patients need, geriatric patients. Everything you can imagine has been impacted in some way or another.
Pretty much every day trying to get tissues right now is really difficult. Tylenol formula, we were kind of at the end of the formula shortage, but I was like, what do people do? I don't know. So we got lucky, we were right at the end of it, but yeah, right now trying to order tissues is, forget it.
Chains have had issues depending, like Walgreens, CVS. So, you may have to try a couple pharmacies, which you didn't have to do before.
I actually work in supply chain for a medical device company, so this is my entire life. And the supply chain disruptions have not only stayed with us, I think they will stay with us quite a bit longer. But I think being kind of on the inside of the industry, I have a better idea of what's going on.
And when we get sick, a lot of people depend on their local pharmacy to have that medication that they need. Now, more recently, drug shortages seem to be a big issue in the wake of the pandemic. Manufacturing, quality control, surges in demand, and even natural disasters can all contribute to the problem. Most recently, a perfect storm of those three viruses, COVID, RSV, and the flu, also known as the triple-demic, created a surge in demand for children's pain medications, which led to a widespread shortage. Here to talk about that and what he's seeing firsthand is pharmacist Vince Hartzell. He's the owner of Hartzell's Pharmacy in Catasauqua. Thank you so much for joining us, Vince.
Thanks for having me, Brittany.
So parents heading out to the drugstore looking for that pain medication for their sick kid who may have a fever and they're not finding it. Is that what you're seeing on the local level as well?
Sadly, yeah. I mean, I thought I'd never in all the years I've practiced see an entire shelf bare of every single acetaminophen and ibuprofen product, chewable, liquid, suspensions, everything. Luckily, we've been able to get them in. I know other pharmacies have been starting to get them in, but it's been a huge burden to overcome.
Sure. What are you hearing from these drug manufacturers, the companies who kind of dole them out? Are you hearing anything from them? And do you have a communication, an open line of communication with them?
So if you go back prior to the pandemic, the easiest thing is I had 2 wholesalers and there would be multiple SKUs of stuff and then it would be pretty easy pickings to get stuff in. Now, like I did my order today, something that normally would take an hour, took me 4 or 5 hours, and I had to go through 6 wholesalers to find acetaminophen just to bring it in, the suspension, the liquid. It's more of a challenge now to find it, so I can imagine how much of a challenge it is for the parents right now that need it. Strangely enough, what I can always find is the bulk containers, but I can't sell that. I need to get a prescription from a pediatrician or a family doctor to dispense that because it's in a bulk container. It doesn't have proper labeling on it. So that's also another challenge. Though I can get the liquid, I can't give it to someone that just wants it. So it has been a huge hurdle. A lot of these companies, they don't have release dates. They don't have that information to provide to us. So I'm kind of blinded on what I can tell my patients as well.
Sure, so that was my next question. What are you telling these, I'm sure at times angry parents who come in looking for this, I need to help my kids. So what's your suggestion to them? What are you telling them?
So what we've done, and I know other pharmacies have done, is if we can, we'll buy the bulk containers, which are usually dispensed off a prescription. And we've called pediatricians and said, hey, Johnny's sick, can we get a prescription for acetaminophen liquid for him? And most of the doctors are fine. They'll just call it in or send an e-script over to us so we can dispense it to them. Not all insurances cover it. Mostly our Medicaid insurances cover it. But at least then we can give them what they need.
Sure, and what are you hearing? What's the reasoning behind some of these shortages? Are you getting a reason? Are you getting an explanation from the drug companies?
Not really getting reasons. I just assume, and my personal opinion is that it's just the perfect storm, like you said before. You have increased demand, you have increased asthma cases, increased viral cases, and all of that's coming together. Hospitals need more, pharmacies need more, your retail stores need more, and I just don't think there's the supply there to meet it.
Sure, some people say that compounding medication may be the answer. Can you explain what that is, and do you think that that's something that could alleviate this issue?
Compounding is when you take a drug or raw material and you make it basically yourself. And we do that at our pharmacy. There's tons of other pharmacies out there that do that. It really depends on what drug you're talking about. For something like acetaminophen and ibuprofen, probably not. There's probably other solutions you can try. But there are some medications that we've had to compound just because market-wise they're not available in the marketplace anymore. And especially for some of your cardiac pediatric patients, you don't want them to go without that medication.
Sure, Vince, you mentioned that there's no release date for a lot of these medications, so do you see an end to this? I don't even want to ask, do you see an end to this, or do you see this going on for the foreseeable future?
So I see it going on for the foreseeable future, but not necessarily Tylenol and ibuprofen. I don't want all the parents out there to be like, oh my God, we're going to be out of Tylenol forever. But I think it will be based off of certain drugs, like albuterol is hard to get right now for nebulizers, but the inhalers are available. So I think the big thing is for any patient out there, talk to your doctors, talk to your pharmacists, see what other options are out there. I talked to a gentleman today who was looking for a medication and called 16 other pharmacies. Wow. And I was fortunate enough to have a wholesaler that none of them had, and I was able to bring it in for him. But I think it's those conversations of, do you really need that med, or is there something similar we can switch you to that'll just be as effective?
Sure, a lot of people, I don't think, knew before this pandemic or before this shortage that you can call around to pharmacies. I know that that's something I've learned along the way, that you can call around to different pharmacies. Is this what you're recommending? Is this what you're telling folks? Should folks be calling the pharmaceutical companies, or should they be calling individual pharmacies?
I recommend talking to the pharmacy they go to. If you're going to a good pharmacy, you should have a rapport with a pharmacist that should be able to answer these questions and steer you in the right direction. 9 times out of 10, there's probably a comparable drug that we can call the doctor on and make a change to. Possibly there's another option out there, or even, yes, maybe we can find it at another pharmacy, or you can call another pharmacy for that solution. But I don't think there's a really depending on the drug, I don't think there's a one answer fits every single patient.
And Hartzell's is a local pharmacy. What about some of these chains? Who's it easier for? Is it easier for the chains because they're big and have a lot of stores, or is it easier for the local pharmacist who kind of can have a rapport with that individual on the other line?
I think it depends on who the pharmacist is at that pharmacy. We have a ton of patients that have been at chains and have come over to us because we can answer those questions. I know there's a lot of other independents out there that can do the same thing. So I really think it depends on the pharmacist. I think if the pharmacist can take the time out of their workflow and take care of that patient, that's the bottom line. That's the most important thing.
Sure. Do you see any long-term solutions that could help alleviate this situation right now?
Honestly, I was hoping that starting in 2023, albuterol nebulizers wouldn't be an issue anymore, but that's still an issue. I went through 6 wholesalers and couldn't find any that are available today. So I guess I just have to keep hoping and praying that supply chain gets a little bit better, but I see it getting better anytime soon.
Gotcha, unfortunately.
Unfortunately.
For all the folks
I think it'll get better on certain things. What I notice is, so like a manufacturer will be able to meet a demand. They'll ship it to the wholesalers. The wholesalers have tons of SKUs, and then pharmacies, hospitals, doctors' offices, they'll order it, and then there'll be another drug that has a shortage problem. So they come in cycles, they come in ebbs and flows. So just because I couldn't get albuterol today doesn't mean there isn't a wholesaler or a pharmacy out there that doesn't have some. So
what's your word of advice to people?
Usually it's call your local pharmacy, see what they have in stock. If they don't have it, if they're a pharmacy worth their salt, they'll tell you where to go and they'll give you some suggestions. If not, call and ask for another pharmacy.
Great. Vince Hartzell from Hartzell's Pharmacy in Catasauqua with some really great information. I know you are a busy man these days trying to track down all of that medication, so we really appreciate you coming on today.
It was a pleasure.
Thank you so much for joining us. Some great information there. And you are watching Community Conversation, Health and the New Normal, presented by Capital Blue Cross, live from the Univest Public Media Center in Bethlehem, Pennsylvania, and also streaming on LehighValleyNews.com. I'm Brittany Sweeney. Many parents say they are feeling more stressed out now than they were 3 years ago. A Hellertown mom shared her perspective about what it's like parenting post-pandemic.
You wake up with a cough and you're like, is it bad enough to stay home? And then you feel bad if you send them to school that, well, they could get other kids sick. It is nice to have the mask option kind of in your head, though, that I could send them to school with a mask on. They still can be there in school. I can still do my work day, but they're a little bit more protected.
Not the only one who feels that way, I'm sure. And on the flip side, school nurses are feeling that strain. The school health program is one of the oldest public health services in Pennsylvania. Prior to the pandemic, school nurses were assessing the health needs of children and communicating those needs to parents and staff. Since the onset of COVID, they now play a crucial role in spotting and stopping the spread of the potentially dangerous virus. Exhaustion, stress, and burnout have deeply affected school nurses nationwide. Joining us tonight is Kelly Keegan, a certified school nurse at the Easton Area School District. Thank you so much for joining us.
Thank you for having me, Brittany.
And you oversee the nurses at the Easton Area School District, correct?
I do.
Wonderful. And so how has your job changed in the past 3 years? If you could talk to us about what it was like pre-pandemic and what are your job duties now that the pandemic has kind of swept through the entire world?
So prior to COVID, we were doing, normal school nurse things, making sure that the students had their mandated vaccines. There's mandated physicals that we need to get, dental paperwork from the dentist, and we were doing that, seeing kids, making sure that they're healthy, taking care of them while they're at school. When COVID hit, it was like nothing anybody had ever seen because we didn't know what to do. But the nurses stuck together. We helped each other through it. We made sure that we were keeping up to date with all the global health entity mitigation plans, recommendations. We would scour the websites and Department of Health, Department of Education, making sure that we were doing what we were supposed to be doing. School districts were creating policy. I was on the COVID team for creating policy and making sure we were doing what other school districts were doing. And it was rough because when we went home, the school nurses were trying to do virtual health at home. We were calling students. We were having phone calls to us all day long, like my daughter or son has COVID, what do I do? I have family members that are home, they're sick, how do I keep them apart? How do I keep my family healthy? And we were answering all these questions, and we got through it. And now we're, over that, and we're catching up because a lot of those students weren't able to go to the dentist. They weren't able to get their physical. They weren't able to get vaccines. And so we're playing catch up now.
Sure, it sounds like you're over the hump sort of for the COVID treatment, but now it's everything else that you have to play catch up with. Let's take a look at a CDC survey. It was conducted in March of last year. It found nearly 45% of school nurses surveyed reported signs of negative mental health conditions in the 2 weeks prior to the survey. Now, with 30% of those surveyed displaying symptoms of PTSD, 24% experiencing moderate to severe depression, 22% experiencing anxiety, and 4% experiencing suicidal ideation. Kelly, have you or your coworkers suffered this? Have you seen your team and their mental health kind of decline over this last 3-year period?
Over the 3 years, we really helped each other. We really had to stick together, and we would call each other or text each other and like just be like, I don't want to go to work tomorrow. I don't know what's going to happen. We were getting calls all day long. And when we were doing contact tracing, it was nearly impossible. I mean, literally impossible, especially for the high school and the middle school, where you have teams, soccer teams or, athletic teams that the kids were together, and then if somebody came down with COVID, we'd have to say, who were you with? Who were you around? Were you within 6 feet for more than 15 minutes? All these prerequisites that we had to find out. And we were doing the contact tracing, and those kids that were in contact with whoever was a positive student had to stay home as well. It was really frustrating for parents, for the coaches, for the school nurses. We were working day and night. I remember working all through the weekends, like contacting people, making sure that I got in touch with them before that they would come to school on Monday.
That sounds draining. That sounds really draining.
It was really rough. And we just stuck together. Like, we just helped each other out. 2 certified school nurses did retire. They just said, I'm done. I just can't do this anymore. But the rest of us, we just helped each other through it.
Sure. Unfortunately, that's not an abnormal story either, people going into retirement, early retirement, because of the stress of the pandemic. Let's take a look at some of the other statistics from that survey. It reported that 48% of school nurses reported feeling bullied, threatened, and harassed since March 2020, with 39% experiencing stigma or discrimination and 24% receiving job-related threats. Can you relate to any of that?
Absolutely.
Making those decisions, those hard decisions for the school, for the athlete that had to play in the game tomorrow, that had to be daunting.
I experienced a lot of that. We were just the middlemen. So we had to follow our district policy, and I understand that parents were frustrated and students were frustrated, and we felt terrible. Like, we would have to call home, and we would get a list of maybe 12 kids that came in contact, and we would feel absolutely horrible having to make that phone call. And we were yelled at, hung up on, screamed at, cursed at. I mean, that did happen. But I think we just tried to understand that it wasn't us that they were mad at. It was just the situation.
Sure. Is there any help or resources for school nurses who are feeling stressed out or anxious right now because of the pandemic?
Not that I know of. We just really stick together. There's 21 of us on my team, and we really, really are tight. We are close. We're friends outside of work, some of us, and that's a really big support.
Wonderful. What are you seeing today? It seems like we're over the hump of COVID. We're living in this post-pandemic life. What is your job like now?
So we've done it. Like, we got through that, and that was the worst part of it. So now when we see kids that are sick, if they're coughing, we encourage them to put a mask on. We, of course, take their temperature. If they have a fever, we send them home. But we do have a lot. We had a program called Test to Stay, and that was so that we didn't have kids always staying home who had come in contact with someone who had COVID. They were able to come to school as long as they were tested at school by the Test to Stay nurses that came in twice a week. And we were going to keep that program, but we saw that we really didn't need it this year. But we do have a lot of COVID tests. So we encourage kids to take those tests home and call us if it's positive.
Sure, and speaking of the kids and the students, what are you seeing among them? Are you seeing any lingering mental health effects from the pandemic? You know, there was these, I want to say the middle schoolers, the 5th and 6th graders who were missed 2 years, and then all of a sudden they're in high school without any transition period. But I'm sure the same could be said for each grade level. How are they doing?
It's rough. We have been seeing a lot of anxiety. I think that's the worst. And anxiety in all different forms. It could be, they have physical manifestations such as headache or stomach ache, or I don't feel good. I just don't feel good. I just don't feel right. I don't know what it is. Or they have, chest pains or shortness of breath. And those are all, anxiety that they're feeling. A lot of students still wear their mask. They feel protected. They've been wearing a mask for so long that it's like they don't even want to take it off. So we see that. But just a lot of anxiety, and kids that were in 6th grade or halfway through 7th, they didn't have that transition period. And all of a sudden, they're in a much bigger building with, they're 9th graders now with 10th, 11th, and 12th graders. And they didn't have that transition. And I could say the same thing for the 10th graders who then are now in college. Like, they didn't get that their junior year and their senior year. And that is really an important transition year for going to the next step.
Absolutely, absolutely. I want to ask, how do you see the role of the school nurse moving forward? Has it been changed forever, or are you going to get back to that pre-pandemic state?
I don't know, but I do know that if anything were like this to happen again, we're ready. We did it. We could do it again. I hope we don't have to, but we would be able to transition right back into that mode. But moving forward, we have to get those kids caught up. We have to get them to the dentist to get, everybody's supposed to go to the dentist every 6 months. You have kids that haven't been to a dentist in 2 years. So we coordinate care with our community partners, and we try and make sure that they're getting caught up with vaccines, their physicals, and anything that they may have missed.
Sure. Kelly, what do you want to say to the parents out there? What should they know when it comes to their school nurses and or helping their children with their mental health or physical health as we move forward?
I want them to know that we are a really important asset for them. We're an important resource, that we will help them with whatever they need. If they don't have insurance, we will help them get connected with somebody in the community that coordinates benefits. We will help get them a dentist, an appointment. Whatever they need, we are here, and we will help them get what they need.
Wonderful. Kelly Keegan, the nurse coordinator at the Easton Area School District. Thank you so much. Some great information tonight.
Thank you.
Absolutely. Well, as I said earlier in the show, I wanted to know what people from the general public thought about the issues we are discussing tonight. Here's what they had to say about COVID's impact on our mental health.
I feel like some people got depressed most of the times because, there was just inside lockdown.
I think people are more anxious and more stressed out about how to cope with a different way to live.
Now that it's over, I almost feel like there's the mental weight of thinking through, well, how many people are going to be there? Well, it's RSV season and the flu season and coronavirus. Is it worth going to this crowded area for this or not?
I could definitely see an uptick in behavioral health, our behavioral health specialist, the referrals she's gotten. A lot of it obviously has to be from anxiety, from the pandemic, people facing their mortality, people who've lost people. We've had a lot of people pass.
Know that it's okay to ask for help.
Some great advice there. COVID affected us all, both physically and mentally. It's taken a toll on health professionals, frontline workers, teachers, and people from all walks of life, and may never be fully measured or known. We have spent the last 3 years fighting the virus and its effects on the body. What now remains is recovering from it social-emotionally. Our next guest is Shonda Morales, a psychotherapist, author, and life coach. Thank you so much for joining us, Shonda.
Thanks for having me, Brittany.
So as we're moving out of these intense 3 years, what are some of the signs, symptoms, ailments you're seeing people move into therapy with?
Well, I agree with Kelly. A lot of what we're seeing is anxiety disorders, somewhat depression, but a really heightened level of OCD, obsessive compulsive disorder, social anxiety, definitely. So, and generalized anxiety like she described.
Why do you think that is?
Well, I think there was a lot of uncertainty, a lot of stress, of course, overwhelm, pressures, and grief. And so not knowing how to feel like this level of uncertainty is very anxiety producing for most people.
Sure, and even in your job position, things have changed how you treat people and how you see people. Just as many people have now gone to Zoom, your line of work has changed as well. How has that changed what you do?
Definitely. We had to rally, and like every walk of life had to adapt to telehealth. And both clients and professionals adapted really quickly, and we found that it's very effective to use virtual telehealth. And so I still use it solely in my practice. People will report mostly, it's very comforting to be at home among their own surroundings. The access is easier, and it's convenient. So occasionally there are those tech glitches and things that show up, but for the most part, everybody's adapted really well.
That's a positive for sure. Yeah. Shonda, when it comes to treating people for COVID, what are some of the methods you tell them to deal with that anxiety or deal with that stress? What are some ways they can work through that?
Dealing with COVID or dealing with anxiety?
Dealing with the stress from COVID.
Gotcha. Starting with the basics, laying those foundations of healthy habits is always really helpful in any scenario. You know, just movement, getting outside, connection with others, having a bit of purpose. All of these things are really important to help us cope with any stressors that show up.
Sure. I want to talk about stigma surrounding mental health. 3 years ago, I don't think we spoke about mental health the way we do today. Is that true?
I feel like definitely is. Case in point, our Democratic Senator John Fetterman from Pennsylvania recently announced that he was checking himself into the hospital for treatment for depression, which needs to be applauded. You know, this transparency and destigmatizing the need for mental health care, recognizing when we need care, whether it's physical or mental health, and modeling that. I think when we have lawmakers, role models, people out in the public eye, accessing that and being transparent, it really helps take the stigma away. Also, on a lighter note, the New York Times recently wrote an article about dating, and so it's seeing about the positive spin that therapy has seen lately is a few years back, if you were dating someone and a potential partner was saying, I'm in therapy, it might be a red flag, when now it's seen as a positive, it's seen as a bonus. Here's somebody who's working on themselves, working on relationships, communication. So I think especially for a younger generation, it's become very positive.
Sure, it's almost, we've seen a lot more self-care happening in these last few years since the pandemic.
Yes.
So when it comes to children, I know that you mostly work with adults, but you work with a lot of parents. What are you hearing from them when it comes to parenting through this pandemic and what they're hearing from their children and how to address that? What do you tell them? How do they address that?
Absolutely. I mean, it's hard to be an adult and do our adulting through a pandemic, let alone taking care of these little ones and attending to their needs. So there are so many pressures from financial to having them feel like there's some sort of security. And when we're feeling uncertain about so many things, the whole idea of when we had to homeschool our children and what that was like and all the choices we had to make. So definitely parents are struggling with keeping their own anxiety in check and those feelings of stress, and then keeping an eye out for their own kids too.
Sure, we were kind of learning together how to navigate this pandemic. Should something like this come along again, what do you think we've learned from it? What should we tell these parents? I know, hindsight's 20/20, right?
Well, and yeah, I think we all shudder to think, but you know, it's a valid question. And so I think we need to keep looking out for each other, without having sort of a hypervigilant eye on our kids, keeping an eye out for these signs and symptoms of stressors of anxiety, sleep disturbances, isolation, depressive mood changes, sometimes avoiding social situations that maybe they had engaged in previously and now feel uncomfortable. So, keeping an eye out, addressing it with them. I always say to parents, we're better off listening most of the time than we are talking. We tend to talk too much. And listening and hearing what's going on with our kids and helping them identify, what are you feeling, thinking, what's driving their behavior. It's hard enough for us adults to sometimes figure out what we're thinking and feeling and what's driving our behavior. So we really need to work with helping our kids identify that.
Sure, a lot of people were able to work from home, do that telehealth option, but there were those working parents as well. Are you seeing some of these mental health issues pop up more in parents who had to juggle working with the pandemic, or the parents who were stuck at home and couldn't leave the house because they had to tend to their family?
All of the above. And I think we know 50 million people left the workforce, quit their jobs in 2022, the Great Resignation. And a lot of those were women who felt they had to make a choice. Do I stay home? Who's caring for these children? And it ended up falling a lot of the times to the moms, to the parents.
Sure, and a lot of people think, oh, working from home, it sounds so great. I can stay in my sweatpants all day, but I don't think I don't necessarily know if that's a fit for everybody. Are you hearing that? Are people kind of feeling down about being stuck at home, even if they are working?
It's definitely a mix, what I hear. I think a lot of people love the hybrid option, a little bit of socialization, a little bit of being able to stay in their comfy clothes. So it's a mix, and some people don't have that option, of course.
And do you think that going from lockdown to then working from home solely, has that had an effect on people's mental health?
Absolutely. What I'm seeing a lot of is social anxiety, kind of the increase in severity of that, and that our worlds, most of our worlds, became very shrunken down and small and quiet. And so when it was time to come back and we started expanding, we're out of practice with how to communicate in person with people, to attend large events. I'm also seeing that people feel very overstimulated more easily than they used to. So people who would never feel overwhelmed and need to have time, quiet time, are struggling and really needing more of that, craving that.
Sure, and what's the impact of having kids at home and then going to school and then masking and not masking?
I mean,
I know, there's so much.
It's that mental load. There's so much to think about, so many pieces that we didn't have to consider before.
Okay, and Shonda, so what's your advice to parents moving forward? And not just parents, people who are navigating this new workforce, this new way of life. What are some tips to them?
Yeah, I think being really intentional about most of us have expanded our worlds once again and kind of opened things up, but being intentional about what we bring into our lives or keep in our lives, whether it's people, commitments. Our world was quite busy and chaotic beforehand, and often it got really quiet. So what do we want to keep and bring back in? And also, again, looking out for each other and not being afraid to ask those around us if they're okay, because sometimes we have that fear of, if I bring it up, I might upset someone or it's awkward, but it's always helpful to check in and ask if we're concerned about someone.
Absolutely, a great piece of advice. Shonda Morales, thank you so much for joining us.
Thanks, Brittany.
All right, well, let's take one last look at what people in the Lehigh Valley community say about living in this new normal. Many seem to have that positive outlook.
I think we've all adjusted to life pretty well and probably picked up some good habits during the pandemic, like more walks and things like that.
People need people. People contact is very important because you cannot be isolated without feeling depressed. It's good for people to get out, see each other, talk to each other, and spend time together.
We do a lot of telehealth now, where before we would have just canceled because we didn't feel good. Now it's, oh, well, I could just do it online. Can you just video call me? We do a lot of that now.
Keep doing your best. Stay healthy, keep moving, and get immunized.
A great outlook for all of those folks to have. And we are back in the studio again with Drs. Friel and Dr. Jahre. I posed this question to both of you. Dr. Friel, I'll ask you first. How has healthcare changed from 3 years ago? It's a loaded question.
The last 3 years feel like that's been at least 10 years. And I think healthcare has changed a lot. We are in a very, very different place. And going back to the beginning, I think with respect to COVID, we are in a better place. We've got therapies, we're much more comfortable with management, but it's still here, and we recognize it's still going to be a force that we have to reckon with for years to come. I think as I look to see the healthcare system, I think it's changed in wonderful ways, like the expansion of telehealth, as we talked about today. But we've also taken our hits, and we have some scars, both as a system, and I think as the individuals who work within that system. I think we're dealing with some of the great important realities right now that are going to be confronting healthcare systems for years to come. We're dealing with a workforce that's been burdened more over the last 3 years. The likelihood of burnout is much higher among physicians and nurses than it ever has been in the past. And that's a real important reality for all of us as leaders to understand and appreciate. And we really, really need to take the time to craft interventions and really create a culture that embraces the new norms and really, but really looks out for all of our colleagues who are still showing up each and every day, working through some very, very tough and challenging times.
Absolutely. Our frontline workers have been our heroes through this. Dr. Jahre, how do you see healthcare has changed?
Well, I think one of the things that we really have to be looking out for, I've always said there were really ABCs involved when we face all the changes that we've been through and what will obviously be future pandemics. And that the ABCs are arrogance, bureaucracy, and complacency. So I think anyone who comes and tells you, well, we've got this right now and now we're prepared for the next one, that is absolutely an overestimation. And by the way, when I said that, I always thought that I was being very original, and then I found out that Warren Buffett has said the same thing about business decay. So I think there are a lot of parallels involved in that. Absolutely. So the main thing that we need to be aware of is, and what we've learned certainly at the St. Luke's Network, is to be flexible. You can't prepare for the last pandemic. That's like fighting the last war. What's going to come in the future is unknown. It probably will be very, very different than what we have. That doesn't mean that we haven't learned some lessons. We have gotten rid of a bureaucracy. We have gained the position of actually having an international reputation because of our flexibility. We were the first to do sterilizing and expanding our PPE, or our protective equipment. We also had, we made our own. We became the poster child for Microsoft Teams. All these things will help us as we go forward. But it's not to say that we have all the answers. And I think if anyone who says that right now just doesn't really have enough experience to know that that's inappropriate. So I think what we have to do is to make sure that we have the culture in place, which I know that my network does, that will help us get ahead of the next pandemic or the next challenge. But by no means should we feel that we've conquered it.
Sure, and I did want to touch upon telehealth. We had mentioned it in the last segment a little bit. So how has telehealth changed? I mean, we kind of know, but how has it changed medical care, and how will it continue to change medical care, especially if some people lose that option?
Yes, there's no question that telehealth is here to stay. I think it's like any other major tool. You have to know where to use it, where it's best, and obviously where not to use it, because it isn't appropriate in all situations. But as I said, Microsoft has used our Teams platform as an advertisement of how to do it and how to do it on an international stage. So we know that we have learned quite a bit, and we're going to learn still how it's going to be useful in the future, but I don't want to make it sound like telehealth is the answer to everything.
Sure, Dr. Friel?
Yeah, I think telemedicine has been transformative. I agree with Jeff. It's not for all patients at all times, but there are certain individuals who will really benefit, and I think we need to continue to advocate that it remains part of what we do. I think it is representative, though, of one of the great things of the pandemic. It's our ability to innovate and our ability to transform. The pandemic put us under great pressure, and like Jeff, I have great pride in my colleagues and my fellow coworkers at Lehigh Valley Health Network for all that we've done, for the ability to respond under duress and under stress, to come up with transformative ways to care for individuals and respond to the community's needs. So whether that was our approaches to large-scale vaccination, the ability to bring transformative therapies to the bedside of patients as we move forward, to get into the households of all the patients that we want to take care of through telehealth and other means. That has really been, I think, the hallmark of what we did really, really well. And it's, I think, a cause for celebration as we move forward. Our colleagues really stepped up, and I can't thank folks enough for what they have given of themselves. I said, you know, people have still bear some scars from what they've been through, but I'm hopeful that everyone who's been here in the trenches doing this work, from the supply chain folks to the nurses to the respiratory therapists to our physicians and other clinicians, that they have a strong sense of pride for what they were able to accomplish, for the fact that they did show up, they cared, and they worked hard to make this a better time for their communities, their families, and everyone they know.
Sure, Dr. Friel, I want to ask you then about staffing. You know, we heard time and time again that there were staffing shortages, the Great Resignation, you know, in every sector, especially healthcare. Are you still seeing that? What are you seeing right now? What's the picture look like?
You bet. So this is a big challenge, and I think right now the challenges of COVID are not so much the virus itself, but the sequelae, the supply chain issues, the staffing issues. The Great Resignation impacted healthcare across the globe. So we are dealing with that, and we are looking at ways to transform our care models to respond to that. We're also trying to look introspectively at our systems, at our culture, looking at the conditions that we allow our workers to come to each and every day, and to hopefully promote cultures that make people inspired to do the work. We're also trying to inspire the next generation of nurses, of physicians. We want people to recognize that there is great reward in doing this work, being a physician, a pharmacist, a nurse, a therapist, et cetera. We need those individuals. We need them to get excited and not turned off by some of the stuff that they might have seen in the news or in the media that wasn't so great during the last 3 years.
Sure. Dr. Jahre, anything to add?
Absolutely. It's often been said that pandemics bring out both the worst and the best in people, and that certainly applies to our healthcare workers who have stuck with us throughout very, very challenging conditions. I will say that although we certainly have staffing challenges, they're reduced in some situations. As you know, we have the longest continually operating nursing school in the country, and we are putting out 4 classes these days. Anybody who wants to go to nursing school and is qualified could literally get a full scholarship to do that full. And so and that's one example, and we obviously have other schools for other areas that are very, very important to us. And what is equally important is not just trying to hire people and giving them bonuses, but to show the love for retention. That's something that is extremely important that we're doing, because otherwise you're going to have 2 different kinds of segments in your population, and we need to make sure that the people that have stayed with us and that are staying with us still are equally appreciated, and we're doing that.
All right, gentlemen, thank you both so much. Some great information tonight. Dr. Jahre from St. Luke's University Health Network, Dr. Timothy Friel from Lehigh Valley Health Network. Thank you so much. And I must say, I think the Lehigh Valley Health Networks in general have navigated this pandemic just wonderfully. So I appreciate all of the information that you have both brought to us. Thank you so much. And that'll do it for this PBS 39 Community Conversation, Health and the New Normal. We want to thank our guests for being with us, and of course, you for watching. You can always get more local news and information on LehighValleyNews.com. On behalf of PBS 39 and Lehigh Valley Public Media, I'm Brittany Sweeney. Good night and stay safe.